Lincosamide, Chapter 15. Lincosamide. Lincosamides. General properties. These closely resemble macrolides antibiotics in their antibacterial spectrum, mechanism of action, and clinical application. Source: Streptomyces lincolensis. Lincosamides are derivatives of an amino acid and a sulfur-containing octase. They are monobases and more stable in salt form, hydrochloride and phosphate. Mechanism of action. Lincomycin and lindamycin bind exclusively to the 50S subunit of bacterial ribosome and suppress protein synthesis. Lincosamide, macrolides, and chloramphenicol, although not structurally related, seem to act at the same site. A lincosamide are bacteriostatics or bactericidal depending on the concentration. Activity is enhanced at an alkaline pH. Bacterial resistance. Resistance to lincosamide appears slowly, perhaps because of chromosomal mutation. Plasmid-mediated resistance has been found in strain of bacteroides fragiles. Cross-resistance occurs commonly among macrolides, lincosamide, and streptogramins group B antibiotics. MLSB resistance. Resistance is the result of methylation of adenine residue in the 20S ribosomal RNA of the 50S ribosomal subunit, which prevent drug in binding to the target site. This cross-resistance is of two types: constitutive resistance (MLSBs), where bacteria show high-level resistance to all MSLB antibiotic, and dissociated inducible cross-resistance (MLSB), in some which bacteria resistant to all macrolides but initially fully susceptible to lindamycin, and rapidly development resistant to lincosamide when exposed to macrolides. Antimicrobial spectra. The drug is active against gram-positive bacteria including penicillinase producing staphylococci, streptococci, Clostridium tetani, Clostridium perfringens, erysipelathrix, actinomycetes, nocardia, and certain strain of Mycoplasma pneumoniae. Its most distinctive feature is its activity against a variety of anaerobes, bacteroids fragile. However, aerobic gram-negative bacilli are not affected. Clostridium difficile strain appear to be regularly resistant. Pharmacokinetic properties can be given by oral IM IV route. Absorption. Lincomycin is incompletely absorbed from the GI tract, especially if administered soon after feeding. Plasma level peak in 1 to 2 hours. About 90% of an oral dose of lindamycin is absorbed, and effective plasma concentration are achieved more rapidly than with lincomycin. Absorption is not significantly affected by the injection of food. Lindamycin palmitate is used PO and lindamycin phosphate IM. The latter reaches peak plasma concentration in 1-3 hours. Distribution. Lincosamide are widely distributed in many fluid and tissue, including bone, but significant concentrations are not attained in the CSF even when the meninges are inflamed. They diffuse across the placenta in many species. About 90% of lindamycin is bound to plasma protein. It also accumulates in polymorphonuclear WBC and alveolar macrophages, such that concentration exceeds those of plasma 50-fold, but the clinical relevance of this phenomena is unclear. Biotransformation. After administration PO, approximately 50% of a dose of lincomycin and 80 to 90% of a dose of lindamycin are metabolically altered in the liver. Metabolite often retain activity. Liver disease impaired the biotransformation of lincosamide excretion. Unchanged antibiotic and several metabolites may be excreted in bile and urine. The proportion depend on the route of administration. Level remain high in phases of some day, and growth of sensitive microorganisms in the large intestine may be suppressed for up to 2 weeks. Milk is also an important excretory route. Adverse effect. Adverse effect. Side effect. No serious organ toxicity has been reported, but GI disturbance do occur. Lindamycin induced pseudomembranous enterocolitis caused by toxigenic Clostridium difficile is a serious adverse reaction seen in humans. Lincosamide are contraindicated in horses because severe and even fatal colitis may develop. Skeletal muscle paralysis may be seen at high concentration. Hypersensitivity reaction occasionally are seen. Lincosamide should not be used in neonates because of their limited ability to metabolize drug interactions. Lincosamide have additive neuromuscular effect with anesthetic agent and skeletal muscle relaxant. Choline, pectin prevent their absorption from the GI tract. They should not be combined with bactericidal agent or with the microlids. The indication. Therapeutic indication. The lincosamide are indicated for infections caused by susceptible gram-positive organisms, particular streptococci and staphylococci, and for those caused by anaerobic pathogens. Lindamycin may be useful in treating pneumocystis colony infections in combination with primaquine. In swine, lincomycin is used extensively in the prevention and treatment of dysentery and sometimes for mycoplasma infection. Sheep, foot rot, cattle, intramammary infusion for mastitis. Dog and cat, treatment of abscesses, osteomyelitis, periodontal disease, and soft tissue or wound infection that involve gram-positive cocci or anaerobic infection. Lindamycin. Semi-synthetic derivative of lindamycin and differ chemically from lincomycin by substitution of a chloride atom for a hydroxyl group. More potent than the parent compound, absorption better than lincomycin, and has reduced the incidence of adverse effect than lincomycin. Antibacterial spectrum and clinical application is similar to lincomycin. It binds with 50S ribosome subunit and suppress protein synthesis like erythromycin. It has replaced lincomycin for aerobic, skeletal, soft tissue, and skin infections. Dose: dogs 5 to 10 mg per kg orally twice a day. Thank you.